where we share each week the latest news and research in trauma-informed care, positive and adverse childhood experiences, and psychological safety. I'm Allison Sabula.
And I'm Bree Twombly, and we are both part of the 10 Collective, where we are working to create a world where we genuinely care for one another. We want to invite you to consider hiring us here at Tend for support implementing trauma-informed care, as well as psychological safety-based programs and policies, so you can better care for your employees, who then can better care for the families and communities that they are serving and partnering with. You can learn more about us on our LinkedIn page or go to 10-collective.com.
Great. Let's get into today's news. Today is Thursday, August 15th, 2024, and content advisory as per usual. We will be talking about trauma, which sometimes includes violence. So, trauma-informed care news. James Cook University, so this is Australian news, and we tend to have a lot of Australian trauma-informed care news. So they're on it. Yeah. So James Cook University, tools to enable dentists to address domestic and sexual violence. So they have launched a groundbreaking set of tools designed to assist dentists across Australia in recognizing and responding to patients affected by domestic and sexual violence, enabling professionals to handle situations effectively. Developed by experts from JCU's dentistry and social work departments, the initiative includes educational videos and documents that focus on trauma-informed care, as well as legal and ethical considerations. And I just want to plug Tend for a second, which is that we can create educational content. That is one of the offerings that we have. So if you have a need for this type of content, we can help you out. Just reach out to us. The resources offer role-playing scenarios, strategies for working with First Nations Australians, and best practices to avoid unintended consequences when assisting victim survivors. Amazing. The Australian Dental Council has made it a requirement for all graduates to demonstrate competency in recognizing, assessing, and responding to domestic and family violence. Freaking amazing. Way to go, Australian Dental Council. Like way to go. Yeah. Yep. So, okay. Idaho set to train 250 sexual assault nurse examiners by the end of next year. Wow, great news out of Idaho. So 4 years ago, Idaho had 17 locations where victims could receive sexual assault exams, and only 3 of them had nurses trained in sexual assault forensics. Today, Idaho has 231 trained sexual assault nurse examiners, or the acronym is SANE, S-A-N-E, who can work out of 37 facilities. By the end of the year, Idaho State Police plan to increase that number to at least 250. That's amazing, especially because, for the population of Idaho, which is a lower, populated state, that's quite a good number. So 18 counties in Idaho have no facility where a person could receive a sexual assault exam trained by a trained SANE nurse. So, okay. So hopefully they're working on those, or people can travel to a county nearby. The Domestic Violence and Sexual Assault Center has a live calendar that gives law enforcement access to which nurses are available and on call to provide the exams. The organization hasn't needed more than 1 nurse at a time, but they have had 4 to 5 day stretches with no nurse on call. All the nurses have full-time jobs, and serving as a SANE nurse is an additional job for them. So if no one is on call when hospitals or crisis centers request a SANE nurse, a mass text message will go out to trained nurses in the area to see if someone is available. Vicarious trauma and having to possibly testify in court create additional stress for nurses. Idaho State Police has grant funding available for 17 soft interview rooms in Idaho this year. Investigators use soft interview rooms to talk to victims after an assault, after it has occurred. So those rooms are designed to look less hostile than most rooms in police stations. I mean, everyone deserves a less hostile room, in my opinion. If they're for being trauma informed here. With couches instead of metal tables, and softer lighting rather than harsh overhead lights. So the Idaho legislature passed a new law effective July 1st that unintentionally prohibits minors from getting sexual assault exams or rape kit exams without parental consent. That's not good. Okay, so this becomes problematic if the perpetrator of the child sexual assault is a parent, family member, or close family friend, according to sources. So, okay, that is a huge problem. So that's funny because I was like, wow, you don't normally think of Idaho when you think of progressive change, and lo and behold, um, that's really really unfortunate because um, a lot of childhood sexual abuse does come from within families. So wow. So, okay, we're calling that out. If you are watching and you're in Idaho, it's good to be aware that that exists, and it could use some good activism and grassroots organizing to reverse that policy. So, we
Yep.
believe in you guys. You got to get on that.
So our next is Safe Babies Court enrolls families in 3 test counties. So I think we've talked about this prior when they were starting to get the funding and the report came out. But a court pilot program to reduce the time children spend in foster care has begun accepting families in 3 counties in North Carolina. So the Safe Babies Court is accepting families in Mitchell, New Hanover, and Yancey counties. This kind of court program came about through a report issued in December of 2023 by the Chief Justice's Task Force on Adverse Childhood Experiences Informed Courts. The task force recommended implementing Safe Babies Court for a 3-year initiative. And just a reminder about kind of what Safe Babies Court is it is really there to help to connect children ages from birth through age 3 and their families who are involved in the child welfare court system with intensive support and services designed to promote healthy development with a safe and timely permanency placement. So it's really focusing on the developmental needs of the child, what are all of the resources that the family may need, and helping to connect them with that to support the whole family with that. So great to see that, and we'll continue to kind of track that to see what their data is showing related to that program.
Great.
Then the next is pre-K, so pre-kindergarten providers on the front line of dealing with growing mental health needs. And so this article was talking about since COVID began, educators have noticed that children are demonstrating significantly more delays, especially in speech. They're witnessing behaviors that are really severe, including aggression toward adults, hitting, biting, spitting, self-injurious behavior, which are things like a child throwing themselves on the floor or hitting themselves, as well as constant screaming as a way to cope with feelings, with sensory overload that's happening for them. And so the early childhood providers are saying we need more help with this. But the current mental health system for getting preschool age children evaluated is often really slow, very fragmented, complex, and difficult for a parent to navigate. So instead of kind of pushing children out or saying you can't be serviced within our program, within our daycare center, the Children First Subcommittee is recommending more funding for specialized teacher training, for adapting centers to create inclusive environments, and for implementing rapid interventions. There's a quote in the report that says, just as $100 million was allocated for mental health funding for K through 12 schools, we recommend equal funding for children in early childhood programs who are experiencing mental health challenges. And that 0 to 6 age, when they're in these early childhood, is such a key developmental period for children. We've talked a lot about this on our kind of weekly segments. And so really important to be thinking about that, allocating funding. And there's just lots of systemic things that are happening in the early childhood area that could use some additional support and funding to kind of strengthen environments and relationships for children. So, yeah.
We don't do a great job in the United States. No. All right. So this is the portion where we talk about research studies. So the first piece is neighborhood resources associated with psychological trajectories and neural reactivity to reward after trauma. So this is in JAMA Psychiatry, July 2024. Longitudinal cohort study of 2,597 individuals, and they are recent trauma survivors in the United States. And so longitudinal just means they're following a cohort, a group of people over time. Having access to residential green space was found to support the development of resilience in people. And so resilience is typically defined as the ability to bounce back after something stressful happens. Efforts to improve access and quality of urban green space may benefit the millions of individuals exposed to trauma each year. And green space is associated with all sorts of mental health benefits. So it's like, yeah, and it's even good for trauma. Not surprised. Individual trauma interventions may be strengthened by adding green space exposure. That's a good one. Okay. From not knowing to knowing, more needs to be done. Healthcare providers describe the education they need to care for sex trafficked patients. Okay, this is in the Journal of BMC Medical Education, July 2024. Researchers interviewed 31 healthcare providers, that means physicians, nurses, and social workers, working in Ontario, Canada, to learn what they identified as their specific education and training needs to recognize and care for sex trafficked persons. Participants voiced their need for specialized sex trafficking education as well as role-specific training to combat their sense of inadequacy and provide better care for their patients. Participants' education needs ranged from requiring the definition of domestic sex trafficking and the frequency of its occurrence to the various circumstances associated with increased risk of recruitment into sex trafficking. In terms of desired training and specific skills, participants wanted to learn how to identify a person being sex trafficked, broach the subject with a patient, know what to do next, including access to local resources and referrals, as well as connections to other critical services such as legal and housing. The results can be used to inform the design and content of education and training on sex trafficking for healthcare providers. So Bree, did you notice if the study mentions that it's trauma informed or not?
It wasn't necessarily mentioning that. It was more of just like addressing some of the needs, and just saying like, what do people know? What do they want to know? And how is it impacting their ability to do their work?
Yeah. So, this type of work can really increase secondary traumatic stress for the healthcare providers. So, we would recommend here at 10 Collective that a trauma-informed approach be used while implementing a new program like this.
Yeah, absolutely. Our next study is one that I was excited about because I have been trained in child-parent psychotherapy and really love kind of that framework. And so this one is called Intervening After Trauma. Child-parent psychotherapy treatment is associated with lower pediatric epigenetic age acceleration. And this was in the Journal of Psychological Science, August 2024. It's very brand new study, either today or yesterday that it came out. So the University of California, San Francisco researchers looked at the effects of dyadic therapy, which just means therapy between kind of often a primary caregiver, so mother, father, grandparent, and the child. So they looked at the effects of dyadic therapy on a biomarker they dubbed age acceleration that tells how fast or slow a person's body is aging compared to their chronological age. And so there have been different studies done specifically related to trauma. And if we think back to the ACEs study, and the body can start to age faster. Right. With experiences of trauma. So we know that is something that exists. So it was really taking a look at that. So the study compared two groups of Bay Area. So thinking about San Francisco area, children between the ages of 2 and 6 years old who had traumatic experiences. Before treatment, both groups had similar rates of biological age acceleration. They did note in the study that more than 80% of the children in the treatment group and 2/3 of the comparison group were Latinx, which is really important when we're thinking about studies, especially related to trauma, because families of color as well as low-income families are more frequently exposed to trauma than white families with higher incomes. But then when we look at research, They are often excluded or not included within the research. So important to have kind of that diverse sample within this research study. So one group received up to 20 weekly sessions of child-parent psychotherapy, and the other group didn't receive any. The 45 children who participated in the therapy had less age acceleration than the 110 who didn't. So this is really suggesting that child-parent psychotherapy supports slower biological aging, likely through promoting things like safe, protective, and emotionally responsive caregiving. So we talk a lot about supporting those caregivers with the children, and that's how a lot of kind of that healing from trauma can happen for young children. So really exciting study to read to see how it's being kind of effective. The next one is following kind of similar. We're talking about the age accelerating again. So this one is called Maternal Adverse Childhood Experiences and Biological Aging During Pregnancy and in Newborns. This was in JAMA Network of August 2024. So the researchers were aiming to test evidence of the transmission of biological embedding of life experience across generations by analyzing maternal ACEs and age acceleration, which they measured in mothers during pregnancy and in their children at birth. It included 883 mother-child dyads. And the findings of the study really suggested that maternal ACEs may be associated with age acceleration later in life, including during pregnancy, supporting a role for maternal ACEs in offspring development and health later in life. So the findings suggest that maternal ACEs may also affect the growing male fetus. This is consistent with previous findings of cumulative maternal ACEs being associated with increased biological aging in children and being more pronounced in male individuals.
Wow.
Yeah, so not only does it potentially have an impact on the mother, but it can have an impact on the fetus and the child.
I am so curious to learn more about the biological mechanisms behind that. Wow. So just a reminder to you all, we post these after we go live, we post this on our website. So if you go to tend-collective.com/blog, you'll find all of these episodes with links to the studies. Some of them have full access, some of them don't. But that way you can see what we're referring to and read more, because there's definitely more there.
Yeah, and I think all of the ones that we talked about this week do have full access.
Oh, great.
When you go. So it's always great when we can have a week where that happens.
Okay, so we've got quite a few psychological safety this week. Okay, great. So psychosocial stressors at work and atrial fibrillation incidents, an 18-year prospective study. And so this is in the Journal of the American Heart Association, August 2024. Okay, this is great. We don't see a ton of psychological safety studies. So a total of 5,926 Canadian white-collar workers, about half and half women and men, free of cardiovascular disease at baseline, were followed for an average of 18 years. Psychosocial stressors at work from the job strain and effort-reward imbalance models are associated with an increased risk of atrial fibrillation, separately and in combination. And so this is part of heart disease. Is that what this is? Mm-hmm. I always want to try and define terms and not assume that you all just know what these very weird, specific medical terms are, but I believe that that's part of heart disease. So job strain was associated with an 83% atrial fibrillation risk increase. That is huge. 83%? Well, what is that? Job strain is associated with an increase. That's huge. Okay, workplace prevention strategies targeting these psychosocial stressors at work may be effective to reduce the burden associated with this illness. So we have been getting a lot of clients lately who are asking us for help with improving culture at work. We love doing this kind of work. We love helping you. Please help your employees prevent heart disease and bring 10 Collective in, because we will help you with this. And we can help your staff with personal regulation strategies, conflict resolution, communication, all these things that make work better. Because that's quite an association. Yeah. Although I feel that none of us are surprised, but it's nice to see the data. So yeah, stress is bad. And we spend 40 hours a week at least at work. Okay, safety should be a performance driver. This is in Harvard Business Review. So considerable evidence suggests that most companies mismanage safety. So most executives frame safety as a compliance issue. They see it as a cost, and consequently, they underinvest in it. So for safety to be an effective performance driver, an organization must ensure that everyone is aligned on what safety means and on how to measure success. It must also introduce practices to anticipate risks and prevent incidents before they materialize. Target training on those practices and incentivize employees to improve safety. So there's an example in the piece how a school district in Texas addressed safety. The district had been experiencing outbreaks of bullying, and the concern was growing that they were affecting educational outcomes and attendance. To address the problem, the superintendent and the school board decided to put students' physical and psychological safety on campus at the core of the district's strategy, framing it as a driver of academic achievement outcomes, parent loyalty, and student attendance. The board included safety metrics in the superintendent's performance evaluation, making 1/3 of his $75,000 annual bonus contingent on meeting certain safety goals. To ensure organizational alignment on the definition of safety, the superintendent met with the school principals, and each one made student safety one of 3 strategic priorities. School principals met with their teachers and staffers in small groups to emphasize how reducing bullying would ultimately improve academic performance and student retention. At the meetings, participants voiced their concerns, offering ideas for combating bullying and sharing success stories, all of which created alignment around what safety means to them. Teachers and staff members used social media and community engagement meetings to communicate with parents and students. They listened to concerns, explained the connection between reduced incidents of bullying and improved academic outcomes, and shared stories of students who had benefited from safer schools. So, so companies often fall into the trap of tracking too many generic safety metrics that are not clearly linked to specific outcomes. So it's important to identify which outcomes are important and need to be tracked in order to make sure that effective change is made. And we say that all the time here at 10 Collective, that it's really, really important to identify what it is that you're trying to change, and then to measure and make sure that that change happens. And that is something that we would love to help you with. So that's a great example. And Harvard Business Review, they really often have, a lot of pieces. We actually have a link on our website with a lot of their pieces on psychological safety in the workplace. And they publish a lot. And I feel like so many workplaces just completely ignore, this expert advice. I don't know how many times Harvard Business Review has to tell you to fire your sociopaths at work, but it's not happening. But the research is there. So,
they have a lot of good research on psychological safety.
Yeah, and it's so clear. It couldn't be more clear. But anyway.
Yep. So our last piece of news today is out of Pennsylvania. So workplace bullying isn't illegal in Pennsylvania. Lawmakers aim to change that. So workplace bullying and psychological abuse are not illegal in Pennsylvania. But lawmakers,
it's not illegal in any state. Yeah.
No. But lawmakers raised the issue during a policy committee hearing Wednesday, so yesterday. So House Majority Policy Committee members heard from advocates, survivors, and attorneys about concerns of a public health threat and the need to protect Pennsylvanians' workers from what researchers call a silent epidemic. So they had experts that testified before committee members about the need for psychological safety. they wanted to kind of emphasize in the article that no laws have been proposed yet. Wednesday's hearing was really intended as a starting point to help explore the issue of workplace psychological safety and to hear from stakeholders and experts. But Pennsylvania House Speaker Joanna McClinton called for a committee meeting to discuss the need for a psychological safety act that would protect workers from this type of abuse. And she said, everyone deserves to be safe at work. That means free from physical harm as well as mental or psychological abuse. While there are laws on the books to protect workers from environmental hazards, we need to do more to protect people from workplace psychological hazards like bullying and oppressive treatment that create toxic work environments and cause undue stress and anxiety for workers. And just a great quote right there that really sums up why we need protection related to safety in multiple different areas and the impact that it can have. So.
Yeah, the one that was introduced in Massachusetts recently stopped moving through, so that one did not pass. But this, I think it's the same. It's the same framework. There's a work kit online, so if you want to introduce it in your state, you can. I think it's Workplace Psychological Safety Act.com, something like that. You can Google this and find it. We'll post a link in our blog, but it gives you everything you need to get this going in your state. So far, none of them have passed and been made into law, but I love that the movement is happening. And it typically can take several years and several attempts to get these types of initiatives to become a law. So, we're just at the beginning here. But I think one thing that these workplace psychological safety acts really need are testimonies from within the state. So, check out the movement online and see where you can make a difference. Thanks everyone for tuning in. That's all we have for today. Really some pretty good news in trauma-informed care and adverse childhood experiences science this week. So we will see you again next week.
Okay, bye everyone.